Rethinking the role of exercise for Achilles tendinopathy.
My name is Dr. Rio and I am a physiotherapist and researcher at La Trobe University in Australia. Right now, loading my tendon with activity increases my pain. Can exercise really decrease my pain? Yes, it can. This is one of the great scientific discoveries about tendon pain. We know that exercise is very helpful for tendon, muscle and brain. But I can hear you saying, what am I meant to do? My tendon hurts. Actually, this is exactly what we used to think. So we have done a lot of research on it. We now know that there is a type of exercise you can start with that actually reduces your tendon pain. This exercise is called isometric exercise because it involves contracting muscles but not moving. Tendons love it, which is probably why people with tendon pain love it. It is way better than rest because when you rest, you actually lose strength and capacity, and you need to build capacity. In fact, did you know that the capacity of your tendon only ever just exceeds the loads that you put on it? This is true for muscle, tendon, bone, in fact, any tissue. Have you heard the term use it or lose it? This helps us understand why rest is not helpful for tendons in the long term. When you rest or reduce your load, you also reduce your capacity. This is why after resting, you can have pain with activities that you used to be able to do. You have exceeded your current capacity. So what's the secret to improving your capacity? Gradual and progressive loading back up to your goals. The only way you can build capacity is by increasing load. Isometric exercise is the best of both worlds. It reduces pain and builds capacity. So exercise is the best thing we can do for tendons, far better than anything passive like shockwave treatment or taping or massage. This also helps us understand why passive treatments don't work in the long term. They don't change your capacity. With exercise, you also get muscle improvements, wonderful whole body and whole brain, in fact, whole human benefits. One amazing thing about us humans is that our bodies are very clever and they can adapt so long as we tell them how to do it. But more about that from Ruth. In the meantime, let's think more about exercise. How can exercise relieve tendon stiffness? Doesn't this symptom mean that my tendon needs stretching? Tendons can certainly feel stiff, but this stiffness or tightness is not due to a short tendon. So you actually don't need to stretch it. In fact, tendons with tendinopathy actually stretch more than healthy tendons. One very cool effective exercise is that it returns the normal balance of tendon and muscle stretch. You might be surprised to learn that stretching can actually aggravate your tendon. Exercise is one of the best ways to reduce this feeling of stiffness. Many patients report their worst stiffness or pain in the morning when they are taking their first steps of the day, and then the pain decreases as their muscles and tendons get warmed up. This is a really important point. We want you to listen to your tendon in the morning. 24-hour response after exercise is the best indication of how you responded to that load. In fact, how you feel the day after doing something is a good indication if your tendon was happy with what you did the day before. If you have less morning pain and stiffness, you are heading in the right direction. If your morning pain and stiffness is the same or better, fantastic, your tendon is happy. That's right. Stable symptoms indicate your tendon tolerated the exercise you did the day before. This is more important than how you feel during exercise. You may have already worked it out that if you've overdone it, your tendon doesn't let you know until the next day. We will teach you how to listen to your tendon and learn how to slowly progress your load back to reach your goals. Will exercise cause my Achilles tendon to rupture? Here is something that annoys tendon scientists. Some websites or educational videos lump together information about Achilles tendinopathy and Achilles tendon rupture, but they are different things. They affect different groups of people. Get this fun fact. The majority of people who have had Achilles tendon ruptures never had tendinopathy pain. Different problems require different treatments, and the best treatment for tendon pain is exercise. It gives you pain relief, makes you stronger, and protects you. Exercise not only helps reduce Achilles tendinopathy symptoms, such as pain and stiffness, but it provides essential loading of the tendon. This improves the structure of the tendon, strengthening it and further protecting it from tendon rupture. Most patients with Achilles tendinopathy have a lasting improvement in symptoms when they are treated with exercise. But many people don't realise how good the right exercise can be. The purpose of this video is to help you rethink the role of exercise. It is understandable and completely normal for people with Achilles tendinopathy to have fear of movement and fear of loading the tendon. However, on the basis of lots of research, I want to reassure you that exercise can not only help relieve your pain, but it will also improve the structure and strength of your tendon.